everybody for logging in and joining us here on this edition of the Minnesota Hospital Association's Endorsed Expert Webinar Series. And just a real quick high level, the Minnesota Hospital Association has a program of endorsed business partners. These are trusted, vetted solutions that we've researched that we think bring value to our hospital membership. And one of the newest entries into our portfolio is a company here called ONEai Health, and they're doing some really great work, forward-thinking work, and it really does touch on a lot of different patient care areas. Today, they're going to focus on behavioral health, among other spaces, and I'm really excited to welcome Dr. Richard Fessler and Stephanie Robinson, who are going to take us through the presentation here today. But before I hand it over to them, just a few housekeeping pieces. We will share back a recording of today's webinar to all registrants, and we'll also attach the slide deck so you can have that to share or review as is appropriate there. Secondly, we will give you a note at the end, so if you have any feedback, please feel free to use that. And finally, lots of Q&A is appreciated, so feel free to use that chat or Q&A box at the bottom of the Zoom window. We'll be happy to take your questions as we go along here today. All right, so with that, I will turn it over to the ONEai team, Dr. Richard Fessler, Stephanie Robinson. Take it away, guys.
All right. Thank you, Drew. And good afternoon to everyone. And thank you for spending some of your valuable time with us. My name is Rich Fessler. I am a recently retired surgeon physician administrator, and I am now the full-time chief medical officer for ONEai Health. Today, I have the pleasure of being joined by Stephanie Robinson. She is the Chief Clinical Officer for OpenMind Health. And together, we would like to show you how ONEai has created solutions in behavioral health and chronic disease management. We'll try to keep this brief and allow plenty of time for questions at the end. So, we're all familiar with this slide. Chronic disease readmissions, SAP resources, and in certain cases result in a loss of revenue from CMS and private payers for holdbacks. For many, this actually erodes what narrow profit margins we have. And regarding behavioral health, we traditionally have struggled to achieve rapid disposition for behavioral health patients, with emergency room beds often being occupied anywhere from 12 to 72 hours in some cases. And we all realize that some of our patients head home after their hospitalization and they seem to fall off the grid. And what I mean by that, they struggle to make their follow-up appointments. Did they fill their prescriptions? Are they taking their medications? What is their state of mind and their level of support when they get home? And these are all issues that ONEai was designed to manage. We actually engage patients daily with a 30-day engagement rate of over 90%. And we have more than 20 disease-specific algorithms. And also additionally, we have 10 to 12 teaching modules should the patients wish to engage with those. And so with that in mind, before I put you to sleep, I'm actually going to turn it over to Stephanie, and she will discuss how ONEai Health has enabled OpenMind to improve their behavioral health client offerings.
Thank you. Yeah, so we're going to have a little video of me talking. But before I do that, I just wanted to talk to you a little bit about how OpenMind Health was able to benefit from it. So we're a multi-state, we're in 30 states currently, virtual behavioral health practice, delivering whole person care, measurement-driven care, and we use both psychiatry and psychotherapy. So our challenge was, on that scale, how do we reduce our risk, keep our clients engaged without overwhelming our clinicians or our admin staff? And cue the video.
I would say some of the biggest impacts for the clients have been feeling more connected to their providers. They've described feeling like somebody's thinking about them or somebody cares about them in between sessions. Providers are busy back to back with the other clients is they don't always have the time to check the messages or check in on somebody that they might be thinking about. So I think that's been a huge impact for the clients to feel that it carries through even when they're not in that 45, 60-minute session with their provider. More importantly than that, I would say the impact on people who are struggling with suicide. We had one in particular, not just one, but a couple. One in particular story where it was absolutely saving a life. It was a client who was a veteran who had increased substance use, lost a job, a partner had left him recently, but more importantly, witnessed a completed suicide of his best friend. So those are some pretty significant risk factors, and it wasn't a client that had been currently engaged. He was engaged and then dropped off for a while. The reach out from ONEai caught him in a desperate time, got the message to us immediately, got the message to the provider who was able to see him right away, and got EMS out to him to prevent that suicide. So I think that was a really big one. I think one of the things that I think is really important about the work that ONEai is doing is, so as someone running a mental health telehealth company, going into a virtual space as a therapist, as a touchy-feely, need to feel the room therapist, I was worried that people would be more disconnected once we introduce technology or enhance our things with technology. However, with ONEai Health, it sort of fits the pieces together. So providers are busy, therapists are busy, you've got that time that you're with your person. They need to feel like that tether follows through during their regular day. And with ONEai Health and the intuitiveness, it really is an attunement. So the person feels still connected to their therapist, and the therapist is able to keep connected to them. So they may be thinking of them as they go through their day, but they're busy and not able to necessarily reach out. This facilitates that. And so it's been enormously helpful. They're an incredible bunch of people. They are efficient. They follow through on things. I'm a busy professional trying to manage a lot of things at my end, and it's like having personal assistants who remind me of what's needed. So they are very focused on making sure everything rolls out as it's intended to roll out, and yet not with a pushy element to it, just a real true collaboration and partnership.
Well, that was me. Thank you, me. Next slide. We're going to introduce you to Jennifer, who is the AI bot. Our practice is currently using the text support, so our clients haven't yet interacted with the bot, but that's soon to come. And so basically it's allowed us to expand our services so that we're able to effectively support people between sessions. Anything else you wanted to add about the bot, Dr. Fessler?
Yeah, so what we've done on our end from an AI perspective is we've taken keywords from the literature. So for example, from the PHQ-9 and the GAD-7, and those are given weight. And so when a patient exhibits more depression or more anxiety, or they've changed their clinical status, that actually forwards an alert to our clinical staff. And that initiates this process of us interacting directly person to person with the provider who's caring for this patient. And I think we can probably, there we go.
Yeah, and so with the PHQ, the other thing that's happening is we're not just supporting people, but we're actually collecting data. And so the PHQ and other structured assessment tools are able to be used. So we're not just checking in, we're collecting real data. And then I wanted to talk a little bit more about the risk protocols. And so when the bot has triggered an alert, it triggers that to a human who then sets a series of events in play. And so we've built a tiered framework for suicidality and crisis. So the AI is monitoring the signals, alerts a human, that human activates the tiered risk response. And that's what you're seeing here is when that risk response is happening. So we're keeping people engaged, supported, monitoring risk, measuring outcomes. The other thing that it does, as well as that, it's opened up new revenue streams for us with the remote therapeutic monitoring. And so we've been able to have some billable time that didn't actually exist for our practice before, as well as retaining our clients. So it's engaging them. They're able to reach back and ask for follow-up appointments, people who had been disengaged, people who have been deactivated even. It's been able to let them reach back out and get rescheduled. So win, 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 cha-ching. So this slide is talking a little bit about, I understand that there's been some discussions with your group around how ONEai might envision working with your hospital group. And so that's with our Safe Path product here. And basically it's talking about we would be able to offer an on-demand virtual assessment, and then the person would get set up with the OnePath, Safe Path product system. And from that system, then they'd be able to be engaged in ongoing care, get that data, and that offer the same thing that we've been able to offer our clients at Oneai Health.
All right. Well, thank you, Stephanie. And so what you're about to see now, this is the ONEai clinical platform. And the ONEai platform is an interactive space where AI insights, chatbot documentation, and clinical oversight from the patient provider all meet. It is a multi-layered platform. We directly engage patients and providers with an initial AI interface, but this is all backstopped with clinical and non-clinical staff at all levels. You can see the biometrics that we measure, okay? These are activity, calories, stress levels, oxygen saturation, heart rate, SpO2. And while we do have proprietary devices at ONEai Health, we are device agnostic. We can actually interface with any Bluetooth device. And depending on the device, we can track anywhere from 200 to over 100,000 biometric data points a day. We correlate biometrics with behavioral information for every patient, again, in a multi-tiered program that has constant AI analysis, AI insights, and multiple layers of human review. And you can see that we have a timer here. So anytime that a clinician logs in, that timer starts, because many of the RTM and RPM codes are time specific, and there are add-on codes for providers that they can engage. So how have we done with this? And I'd like to share two things with you. I will fully admit 4 years ago, I was the beta study. And by training, I'm an endovascular neurosurgeon. And I was quite frustrated over what really is the recurrent stroke risk in my patient population. I think we've done a fantastic job of getting stroke patients the help they need immediately. I think we've done a really bad job of secondary prevention, because recurrent stroke risk is the same in 2025 as it was in 1997, and it is still 50%. And so what we did is we actually took 82 of my patients and we enrolled them in the ONEai Health program. And what we found is that all of those patients had, quote unquote, controlled hypertension. And yet within 30 days, we found that 40% did not. And over the course of the program, more than half the patients actually had treatment plan changes by their primary care physician. And let me just elaborate. Why is that? Well, I go see my primary care physician every 6 or 12 months at 8:30 on a Friday, because that way I know he won't be super late. But I also know that most of you and most patients do the same thing. Same time, same day, separated by months. Sometimes you're hypertensive in the morning, sometimes the afternoon, sometimes at night. And these are some of the things that we found as we began to initiate this program. PACE of Southeastern Michigan. Okay, the program for all-inclusive care for the elderly. It is a federal and state program. It is a capitated care program. PACE of Southeastern Michigan is a vulnerable population in Detroit, and they gave us 120 of their patients that we worked with over 4 months. 61 of the patients elected to go along the ONEai health path. 59 did not. At the end of 4 months, the ONEai health patients had been to the emergency room and had been hospitalized at 50% the rate of the ONEai health patients. For that small group, the first 3 months of that intervention saved almost $300,000 for them. And if that were to be extrapolated across their 2,000 patients, it would result in nearly a $12 million a year savings for them. We work along 2 models. One is traditional fee-for-service, and this is what most of our private practice organizations elect to proceed with. The other is a shared risk model. And typically, if you have a capitated population, or if you are a health system or an insurer, this is typically the model that we engage with. And then finally, what I think is that we believe that our platform is unique in that we are leveraging our AI technology in a fundamentally new way that creates a system of care that benefits everyone who comes to this table. And what I mean by that, the patients benefit with engagement levels that are greater than 90% at 30 days. They have disease-specific clinical pathways for both their behavioral health issues as well as any chronic conditions that they have. We have educational modules that they can have sent to them to learn about their medications and their conditions. We actually help providers become more efficient by giving them tailored patient-specific information, and we give them a documented, clinically compliant billing process. And finally, we're able to drive down costs at the system level by providing front-end patient engagement and proactive alerts to avoid ER visits. And we've shown that across several practices. And with that, I would like to thank you for your time. I look forward to meeting many of you in person in the future. And I think we've got plenty of time for questions if you'd like.
Yeah, one that's come in. Can you say a little bit about the monitoring devices themselves? Can you just expand a little bit about how that works and walk us through that somewhat?
Yeah. So as an example, if you can see me, I'm wearing one of our rings. I charge it every 11 to 12 days, and I can swim in it, whatever, do everything in it. And that device provides about 300 biometric measures a day. It also tracks my steps. It works through my phone. So it's connected to my phone, and my phone will intermittently transmit that information to the ONEai platform. However, we also work with the Apple Health Kit. We can work with your Samsung smartwatch, your Fitbit, any other device that measures any type of biometric activity can be fed into the Open Health platform. That includes Bluetooth scales, blood pressure cuffs, glucometers, and all sorts of things, actually.
I can attest that the ring makes it through the washer and dryer, just in case.
Sounds like personal experience there. Well, we'll have the questions keep on coming in for all attendees. Please feel free to use that chat or that Q&A box. And can you dive a little bit more into the revenue piece for hospitals and health systems? I know you touched on kind of the models, the 2 models that are out there today. but how are insurance companies reacting towards this proactive approach, trying to keep those readmissions down, and how has that proven to be a good revenue stream for providers?
Oh boy. Well, you probably need the business guy instead of the doctor guy for that one. Um, what we have, and hopefully I'm getting to the heart of the question. So we've had interactions with multiple capitated care programs, for example, on the island of Puerto Rico. And they see a real value in that. They believe that our model and our platform will be able to help them keep patients away from admissions. And one of the things, for example, that's unique and that we would like to do there is to help actually perhaps drive patients into healthcare system clinics and urgent care centers when appropriate, clinically appropriate, in order for their physicians to have first glance at their own patients.
Good. And I know behavioral health was one of the focal points of this particular presentation, and there was a slide that touched on some of the other use cases or chronic conditions that the devices can help monitor. Can you expand a little bit about some of those different disease states and where you've seen it be most effective, and how you've seen it be most effective with them?
Yeah. So, for example, we've onboarded a large cardiology practice, and they have a strong interest in medication compliance. And so we've begun with educational modules for a cohort of their patients in order to encourage them to remain compliant. We also have a full program for their coagulation clinic patients. Reminders to get them to come in and have their INR measured, daily education around anticoagulation and warfarin. And that particular care pathway also has been broken down along multiple fronts, which are medication based, right? So many of our patients that think that an anticoagulant is anything you take that quote unquote thins your blood. So whether it's a direct oral anticoagulant, warfarin, aspirin, Plavix. And so we've actually taken all of those, we identify what the patient is taking, and then we give them a specific educational module as it relates to whatever medication they're actually taking. Similarly, COPD, CHF are just a few of our other clinical pathways. We're also, while we do depression on the behavioral health side, we've also embedded the GAD-7. So what I mean by embedded, within Ms. Robinson's practice, a therapist has to get a paper copy of a PHQ-9 or a GAD-7 every month. We have taken those forms and weighted the terms, and we have embedded them into our chatbot so that while the chatbot is actually having a relative conversation with a patient, in the background, we're generating a quantitative score for each of those measures. So those are the kind of things that we do.
Just looking at the attendee list for today's webinar, there's a wide variety of size of hospital or health system on our call here today. Talk to me about that. Does it matter whether you're a small critical access hospital or a giant system? Does your solution work better for one over the other?
We don't think so. I'm a good example. We started with me. And I'm small, so I'm the equivalent. My practice would have been the equivalent of a critical access hospital. I enrolled about 80 patients, right? 82 patients. But what I found is that there was a lot of information there. And, of course, I was worried about it financially, but it actually, in my case, offset the cost of the nurse practitioner who worked with me. And she was in charge of looking at things. And we went over things together whenever it was necessary. Now, on the other hand, we are scalable, and we have built it all to be scalable. And so, we brought on about, I believe, 9,000 patients in August. And that was a pretty seamless process. So we have the ability to do that.
Great. And then just maybe kind of maybe your own just personal perspective about remote patient monitoring in general. I think there's maybe a wave of opinion that this is the future of healthcare, instead of maybe just that snapshot you get in a one-time visit to the doctor or the hospital in this case, but rather it's an ongoing version of step counts and pulses that we all seem to have on our wrists these days, but kind of taking that to the next level. Is that the way that you see the macro trends going?
Oh, Drew, you're like planted questions. You're so good. Thanks. Well, I do. And, much of my career, I have spent designing systems of care, and most of that around stroke patients and telemedicine. I actually believe in what we're doing with this company enough that I retired from clinical practice sooner than I otherwise would have. And why is that? And I will admit, I'm initially skeptical about a lot of things. But as an example, we were with many people in Puerto Rico in July. I returned from a week there, and 36 hours later, I was incredibly ill with COVID. A month later, I was going through my own ONEai biometrics. 24 hours, 24 hours before, the program had actually made a note that it appeared that I may not be well and that I may be becoming ill. Spot on. And but in my mind, the way I see this, I see this technology as allowing us to engage a person who has a wearable that they've made part of their life for whatever reason, Fitbit or a ring, whatever. And perhaps we pick up that 33-year-old that has early onset hypertension and treat them 10 years ahead of when they might have presented to an emergency room. And they never go to the emergency room. They never have that stroke. They never have that heart attack. We actually get them engaged. And for self-insured companies, this is huge. I mean, imagine how good you look as an employer when you give all your, employees a free Fitbit on the first of the month. And yet at the same time, you're able to get those folks health care that down the road would have led to disability, right? And you just avoid that secondary cost. It's something that people have been asking of medicine for decades, right? Self-insured companies, insurance companies, they don't always believe that they're getting value from medicine. I think that what we're doing right now will bring value to medicine.
Certainly a powerful tool. Just one more for a entity looking to learn more or maybe take the next step with ONEai. What does that typically look like?
So they can just reach out. They can go through the website. They can send me an email. They can call, and we will be back in touch with them as soon as they would like. We will schedule a presentation. We'll learn about them. They can learn about us, and move forward from there.
Oh, terrific. Well, I see your information is here on the screen. Just a reminder to those attendees who maybe joined a little bit later, we will send out a copy of this presentation along with the slide deck a little bit later here this afternoon. So that'll be coming into your inboxes shortly. Well, I don't see any more questions, so I think we can wrap it up right as we approach here the bottom of the hour. So thank you, Stephanie. Thank you, Rich, for your expertise and your insights here today. I think it's really the cutting edge and the future of healthcare, and we're excited to have you part of the Minnesota Hospital Association's Endorsed Business Partner Program, and look forward to seeing the great things and the great work that you're going to do here in our state.
Oh, we appreciate it. Thank you very much for your time.
All right. Thanks, everybody. Appreciate you joining here today.